If you have nagging itch, one of those itches that just affects any body part, whimsically moving from one body part to the next, maybe affecting the entire body sometimes it would seem, then this video is for you. Now, chronic itch is a very common problem. It can affect people over weeks, months, sometimes years, and in extreme conditions, sometimes even decades. I've come across people that weren't able to get a good night's sleep for decades until we were able to treat their problem effectively, thank God. But a lot of the times, these people kind of just shuffle through life and are not able to address their issue. Now, chronic itch is a very common problem, as I said, and it can happen for various reasons. For many reasons, it can actually occur over an area of the skin that's affected by a chronic inflammatory condition, like eczema, psoriasis, seborrheic dermatitis. Even rosacea can be itchy. Hives can definitely be itchy, especially when you're dealing with chronic hives. You're definitely dealing with something that's going to be a long-lasting problem. But then there is another set of itchy conditions that are a lot more frustrating than the inflammatory-based conditions, because those are itchy conditions where the skin is apparently showing very little change, if any. And those people are just as itchy as anyone. And you're probably wondering what the hell is going on here. Well, you're not alone in wondering what the hell is going on here. Itchy conditions, what we call primary or secondary itch without any skin changes, are actually pretty common. And there are many different causes that cause itch without a rash on the skin. Some of those conditions include liver dysfunction of various kinds, in some forms of liver inflammation or infection, such as hepatitis C. There is a type of itch that's associated with renal dysfunction, what's called uremic pruritus or itch. Then there is itch that's related to thyroid disorder or dysfunction that could show up whether you're hyper or hypothyroid. Chronic infections can lead to chronic itch, infections like tuberculosis, for instance. Certain types of blood cell proliferation or cancers like mastocytosis or leukemias, lymphomas, even multiple myeloma, which is a bone marrow cancer. All of these can be associated with chronic itch, and in many cases, the sufferer just goes on through a long period of time not really understanding what is wrong with them until the blood cancer is diagnosed. Iron deficiency is another very common cause of chronic itch that's seldom recognized, and fixing iron deficiency can actually fix a lot of cases of chronic itch. And then there's a subset of patients with whom we cannot find anything wrong, not through history, not through medications, which can sometimes lead to itch, specifically when we talk about opioids and other pain medications. And those patients are considered what we call idiopathic itch patients. They are suffering from itch that is not really distinguished for any one particular cause. It can have a neuropathic cause or a multitude of causes coming in together to bring about the itch. But in many of those cases, there's nothing apparently wrong with the patient, and we can't really put our finger on why they're itchy. But that does not mean that we can't address their itch very effectively in many cases. Well, what can you do? Well, first of all, know that you're not alone. There are many people out there that are suffering from a very similar problem to yours, meaning they're itchy all over the skin or multiple areas that are just whimsically moving and affecting multiple areas on the body, and that can be a very serious problem. Second, take great care of your skin. A lot of people suffering from chronic itch do have dry skin, and with the itch, people tend to reflexively undermine the skin barrier, which can make the skin worse. So avoid excessive cleansing, avoid hot water, avoid scrubbing with physically abrasive devices like the loofahs, the brushes, the washcloths. Avoid exfoliants of any kind or scrubs. All of these things are going to undermine your skin. And even if you're not suffering from itch due to dry skin, you're still going to get some benefit from protecting your skin barrier and making sure that the skin barrier is intact. Third, make sure that you're not suffering from any chronic condition or taking any medication that could lead to your itch. So you may want to have a talk with your primary care physician or your dermatologist to make sure that you don't have any condition that is undiscovered or unknown, or maybe is known but is not well controlled, that is leading to the itch that you're suffering from. Make sure that all the T's are crossed, all the I's are dotted, that you're not taking any medications that could be making your itch worse or inducing the itch in the first place, that could be a very good discovery for you if you can change medications or stop taking a certain medication and end up not itching or itching less. That would be terrific. Now, some types of itch respond to over-the-counter antihistamines, specifically medications like cetirizine or levocetirizine. In some cases, those can be helpful to control the itch, decrease the itch, or even make it go away altogether. So you can maybe give those a whirl and see if they work out. In certain cases of localized itch, menthol-containing solutions or pramoxine-containing medications or lidocaine-containing solutions can actually help control or decrease the severity of the itch, especially when it's localized over specific areas of the body. And then over certain areas that are affected with neuropathic itch, such as between the shoulder blades in the case of notalgia paresthetica, or over the arms right here in the case of brachioradial pruritus, or down on the shins in the case of shin itch that is related to neuropathy. Those conditions may respond to a cream called capsaicin cream, which is essentially chili pepper cream that you can apply over those areas. Be sure to apply with gloves on so you don't touch it with your bare fingers, end up touching your own eye and burning. But the application of capsaicin cream to certain areas of the body that are afflicted with chronic itch may actually relieve the itch after a brief period of burning that burns through the itch and makes it go away. So that could be a pretty fantastic solution to some of those chronic cases of idiopathic itch on the body. Now, suppose that you've not gotten relief. You've done your homework. You made sure you're not suffering from any particular condition that could be making your itch worse. Everything is under control. You've ran through the gamut of various solutions that are over the counter to control various types of itch and have gotten nothing. Well, it's time to see the dermatologist. Your dermatologist will talk to you in detail, and we'll see if there's anything that you left uncovered, which will require additional attention, maybe sending you to your primary care physician or other specialties to address. And then once the entire workup is done, if you still have not uncovered any particular cause for your itch, there are prescription medications and technologies that are available in the clinic to address itch. There's a variety of prescription medications that can help primary itch of many different sorts, specifically medications like gabapentin or pregabalin, doxepin, which is an old school antihistamine, sertraline, and even opioid receptor effectors such as naltrexone, which can be very effective in a variety of different kinds of itch, whether the reason is known or unknown. And what you're going to do is talk to your dermatologist. You're going to review your options, make sure that the treatment is a good fit for you, and give it a try for usually a few weeks to see if you're getting any traction with relation to your itch, if you're getting the relief that you need. Maybe you're getting some relief, but not altogether everything that you needed. And you will work this out with your dermatologist to make sure that you get to a good place as far as the itch is concerned, and then you can take it from there. Now, there are some combination medications that you can apply topically to various areas of itch. Those contain a combination of prescription medications, antidepressants like amitriptyline or ketamine, and anesthetics like lidocaine in a combination can actually be very effective for itch of multiple reasons and causes, and they can make a big impact, especially when applied locally. Those need to be compounded especially, and they can be compounded by your dermatologist or at your dermatologist's request by a compounding pharmacy. You just need to be aware of that, and if that's a good fit for you, that may be something that would be of great value for you to be able to be in charge of the itch and treat it as needed. Another great technology that can control many cases of itch is use of narrowband ultraviolet B radiation. That can be used in clinic through a special kind of light booth, and there's even a home version available. In case this technology has worked out for you in the past, you may be able to get a home device and even get it covered by insurance so you can treat yourself at home once the parameters of the treatment have been established at your dermatologist's clinic. You may be able to get that device for your home and treat yourself as needed. Now, the interesting thing about itch is that when you find the right solution for your type of itch, the response is often pretty quick. It can happen in days or short weeks. All you need to do is be persistent and work with a dermatologist who is dedicated to find the right solution for you, and understand that that may take some trial and error, because every person is a little different, every itch is a little different, and you need to find the right fit that works for you. In my career, I've come across some very memorable cases of patients that have suffered from itch for years or even decades, that haven't been able to get a good night's sleep in a very long time, and with the understanding that I was on their side, that I was going to help them whatever way I can to find a solution for their itch, they stuck it out. And we find some pretty amazing solutions and some great relief for people who've suffered through a lot of sleepless nights. So I encourage you to find that dermatologist to work with you on resolving your itch. First of all, finding out what is wrong with you in the first place that can be corrected and fixed. And second, if there is nothing, or even if there is a clear cause for the itch, and your itch is not going away with fixing the apparent problem, there are still solutions that you can employ with the help of your dermatologist to bring your suffering to an end and finally get a good night's sleep. If you found this video helpful, don't forget to give us a thumbs up. Also, don't forget to share this video and subscribe to the channel. Thanks for watching. God bless.